the Secretary of Finance can go ahead and approve a contract even if we don't think it's appropriate. Most people don't know that. They want to know why the legislature keeps approving all these committees, and we don't. So we need some transparency for them to understand that. With that being said, we will move forward. The first item is consideration of the minutes of January, or actually of, let me grab my paper here. Yep, of January 14. Is there a motion that they be considered as being approved?
So moved. Second.
We have a motion by Secretary Meredith and a second by Co-Chair Hart. Clerk, please call the roll.
Senator Meredith.
Aye.
Senator Richardson. Senator Thomas.
Aye.
Representative Bauman.
Aye.
Representative McCool. Representative Rorks.
Yes.
Representative Hart.
Yes.
Chairman Douglas.
Aye, yes. Okay, motion carries. Total number of items on the agenda today equals 240 in the amount of $5,373,228,068 All vendors are registered with the Secretary of State's office. The next order of business is consideration of the agenda, including the personal services contract list, the personal services contract amendment list, the memorandum of agreement list, the memorandum of agreement amendment list, and the Kentucky Entertainment Incentive Program agreement list, except for those items selected for further review. Do we have a motion to consider the contracts reviewed without objection?
So moved.
Second. Representative Co-Chair Hart made the motion, and Senator Meredith made a second. All those in favor of the vote, say aye. All those opposed, say no. Clerk, please call the roll.
Senator Meredith.
Aye.
Senator Richardson.
Aye.
Senator Thomas.
Aye.
Representative Bauman.
Aye.
Representative McCool. Representative Rorks.
Aye.
Representative Hart.
Yes.
Chairman Douglas.
Aye. It seems the motion carries. Now, the first item on the pulled list are with the Attorney General, and they are items 1 through 7. On the routine personal services contract list, I am going to ask the committee, since these are questions that I have addressed. I'm going to ask the committee if they will bear with me and allow questions number 1 or these contracts 1 through 7 to be considered together. Are there any objections to that? No? Okay. With that being said, we have people at the table. Would you introduce yourselves for the committee, please?
Good afternoon, Mr. Chair, members of the committee. Will Schroeder, Senior Counsel.
Chris Lewis, I am the Division Chief for Consumer and Senior Protection.
Justin Clark, Assistant Deputy Attorney General and Chief of the Civil Division.
Okay, gentlemen, would you please raise your right hand? Do you solemnly swear to tell the truth and the whole truth?
Yes, sir.
Yes.
Thank you. My questions that I had for these contracts, and I know you gentlemen do a wonderful job, but we are looking at 7 contracts. I think asked for $20 million each. Could you please help us on the committee understand how much of that money is actually used each year in this particular space?
Thank you, Mr. Chair, and I'll begin. I'll let these gentlemen answer the details about the contract, but just a broad overview. All 7 of these are going to be contingency fee contracts. What we do when we get the request, we always put the max amount that each of these firms can make. So this is not a guarantee that any of them would receive this. This is the max amount, meaning they would be bringing a lot of money back for the Commonwealth of Kentucky. In the past, some Attorney General's office would actually put 0 because it's a contingency fee. However, in our look at prior contingency arrangements, there's never been a 0. So we prefer to put the max and then explain basically what the cases are. But basically, it could be from 0 to this amount, but this is not a guaranteed amount.
Sure. And these are all governed by the statutory waterfall that's in 45A 717, which is to say, for one of these contracts to return a $20 million fee, there's going to have to be a $355 million return to the Commonwealth before the waterfall would maximize a $20 million fee. So it really is a matter of, I think, in our thought, being more transparent that this could be the ultimate payout of the contract, but it's certainly not guaranteed, and it is governed by that statutory waterfall.
That's what I really want. A lot of the questions that we're going to be asking are things that we really want our constituents to know. And I think it's really, really important for us to have some transparency here, so that they can have an understanding of how their government works. Now, do we have a motion to consider the contract? Are there any questions regarding this contract? I'm sorry.
Church, you become chairman, you just kind of take over, don't you? Just simple question: is this the same listing we saw last year? Are there any new firms added, or any firms deleted?
There are a few new firms to this one. Let's see, the new firms I believe would be the Milberg firm, Morgan & Morgan, Edelson, Cohen, and Motley Rice for this batch. The others had prior ones, and part of the reason you're seeing these, I think you'll recall, and we've had these discussions before, is related to the early opioid contracts, where multiple cases were being let under a single contract number. To try and avoid that, we are doing panel counsel contracts and doing these in batches every 6 to 12 months, so that we have those fresh contract numbers that we can plug firms into cases as they arise, and not be in a situation where either we're letting multiple cases under a single contract, which I know is not preferred by the committee, or in the instance that we have to bid out a specific contract, often that contains details that may tip off a target that the office is investigating, and we try to avoid that. And so that's why these will probably be coming up on a 6 to 12 month process going forward, to keep those fresh contract numbers in place. There's nothing that guarantees that any of these 7 firms will ever receive a case. But the ability to let a case that's appropriate for that firm and for that firm's specialties and expertise is there.
This previous cycle, how much did we actually spend?
To date, I don't believe we've spent anything off of
Okay,
the prior cycle.
thank you.
Yeah, those cases will be going on for a number of years. So
Okay.
sometimes these cases are 3 to 5 years down the road before there's actually any sort of payout that occurs on them.
Is the book of business, so to speak, is it relatively large?
It's potentially robust.
Okay, thank you.
Yes.
Thank you, Mr. Chair.
Any other questions? No one else has questions? Okay. Do we have a motion to consider the contracts 1 through 7 reviewed without objection?
So moved.
We have a motion by Senator Meredith. Is there a second? Second by Co-Chair Hart. All those in favor say aye. All those opposed, clerk, please call the roll.
Senator Meredith,
Aye.
Senator Richardson, Senator Thomas, Representative Ballman, Representative McCool, Representative Rourks,
Aye.
Representative Hart,
Yes.
Chairman Douglas.
Aye. Aye. Motion carries. Thank you, gentlemen.
Thank you, Mr. Chairman.
Thank you.
Mr. Committee.
The next item from the pulled list is from the Cabinet for Health and Family Services, Office of the Secretary. It's number 9 on the routine personal services contract green list. If the representatives are here, or are they going to be? Okay.
I'm virtual. Yes.
They're going to be virtual today? Okay, thank you. Co-Chair Hart has some questions for you.
Sure.
Co-Chair Hart.
Thank you, Mr. Chairman. To be clear, this committee, we're very appreciative that y'all desire to the training on state procurement policies. But my question would be, why is there a need, or can you explain the need to go outside of the state government to get the training on the state procurement policy? My follow-up or a further question on that would be, is the training not already being provided?
Sure.
So I'm happy to answer it. My name is Astrid Masterson, and I'm with the Office of Administrative Services. So to answer your question, very limited training is provided by finance, and it's Kentucky specific. This organization provides a more global view, and then we can adjust and apply it to Kentucky rules. Also, our cabinet receives federal funds, and finance cabinet is not able to do, or does not currently do, training on grants or federal funds and procurement laws and regulations as it relates to the federal side. So we exercise that as well for this. I also just wanted to note for you that the contract is an up to amount and covering us through June of 2026, should we have any trainings.
All right. Okay. So basically, I mean, if we're looking at this and trying to evaluate whether or not the in-house training is adequate or not, and I'm just going to rephrase this so that I make sure I understood you clear. You all, this company provides training on more of the global federal level perspective, and then what you all do in-house is just specifically related to Kentucky. And I guess I'm going to ask, do you all feel that's adequate to train your personnel on the whole process?
These additional, yes, you're correct. And yes, we do feel that these additional trainings are provided for our staff, help them learn the process more and help them in multiple different areas of procurement. So finance, we have to do certification with finance cabinet to maintain our spending authority. And actually the finance cabinet has us attend, or it requires us to attend training through this organization as well as part of their training mechanism as well. So finance uses this National Institute of Government Procurement as well for training opportunities.
All right. Thank you. That's all the questions I have, Mr. Chairman.
Thank you, Co-Chair Hart. Any further questions regarding this particular contract? Okay. Do we have a motion to consider the contract reviewed without objection?
So moved.
Okay. Motion made by Co-Chair Hart, second by, was it Senator Richardson? Oh, Representative Ballman. Clerk, please call the roll.
Senator Meredith. Aye. Senator Richardson. Aye. Senator Thomas. Aye. Representative Ballman. Aye. Representative McCool. Representative Rourke.
Aye.
Representative Hart.
Yes.
Chairman Douglas.
Aye. Motion carries. Thank you so very much. Next item on the pulled list is with the University of Kentucky. It is number 28 on the routine personal services contract green list. If the representatives are here, excellent. Please identify yourself for the record. Mr. Locke, would you make sure, number one, that your green light is on, and number two, that you pull the microphone just a little closer to you?
Yes, is that better?
Thank you very much. Excellent. Now, I do have a question regarding this particular contract. One of the things I noticed is that this actually has an open completion date. It says January 22nd, 2025. I'm looking for when this contract is supposed to end, because I have to ask whether or not there will be future asks regarding this contract down the road.
No, this project should be finished. The goal for this project is substantial completion by the end of 2026.
Okay. All right. That was my question. I don't like open-ended contracts.
That, and I apologize for that oversight on our part.
Any other questions regarding this contract?
Mr.
Senator, Senator Thomas has a question.
Yeah, I was going to say that just seems like, I mean, he indicated that it's going to be to 2026. I was not concerned with the amount of at all. This seems within the ballpark, the $1.6 million for architectural design. So, I mean, I accepted his word that he'll be through by 2026, and I would like to move to approve the contract.
Prior to doing that, however, Senator Meredith already had raised his hand for a question.
Just further explanation, again, you got to appreciate, we have very limited information when we received this. And I think the question was good about when's the end date, and you say 2026. Is that just for the design portion?
No, sir, that's for the entire project, substantially complete by the end of 2026.
So
We would have a 1 year for final warranty walkthrough and all of that. So that, if you want to add that on to it, that would bring it out to the December of 2027 for the final warranty walkthrough, just for the warranty at the end of the project. But substantially complete, have the College of Agriculture, Food and Environment moved into the building by the end of 2026.
Well, that's very aggressive. I appreciate that. I hope you accomplish that. But what's the total cost of the project?
The total cost is $23 million.
Thank you. All I have, Mr. Chair.
Thank you, Senator Meredith. Senator Thomas, you've already made a motion?
Yes, sir, and Representative Rourke has seconded.
Yes. I just want to make sure I got that on the record. All those in favor of the contract, approving the contract, say aye. All those opposed, no. Clerk, please call the roll.
Senator Meredith,
Aye.
Senator Richardson, Senator Thomas, Representative Bowman, Representative McCool, Representative Rourke, Representative Hart,
Yes.
Chairman Douglas.
Aye. With those votes, the motion carries. Thank you very much, sir.
Thank you.
The next item on the pulled list is with the Department of Community-Based Services, and it is number one on the personal services contract amended Ivory list. If the representatives are here, okay.
I'm here.
Please identify yourself.
This is Misty Salmons, the Director for the Division of Administration and Financial Management for DCBS.
Okay, well, let me back up. Would you please raise your right hand? Do you solemnly swear to tell the truth, the whole truth, and nothing but the truth, so help you God?
Yes.
Proceed.
So this contract was increased due to, we had an RFP out for this work last year, and there was a protest on the RFP. PCG was the current
Pardon me.
vendor.
Who is PCG? Again, I don't like acronyms.
Public Consulting Group.
Thank you.
Sorry.
Thank you.
Public Consulting Group was the previous vendor, and we extended their contract while we waited for a determination from finance on the protest. After the determination, we have to reissue the RFP, so we had to increase the funds for Public Consulting Group to continue the work.
I'm sorry, since I've asked the question, and you anticipated one of my questions, which was why the increase. I'm not sure if I understood that answer. Could you repeat that for me? We're using the same public consulting group. Is that true?
Yes. Yes.
But they're saying they want a 50% increase in.
So initially, the contract was only through the first quarter of the year because we had put out the RFP and it was awarded to another vendor. The contract for Public Consulting Group was supposed to end at the end of September. We extended it out for a little bit after that, waiting for the determination from finance. Once the determination from finance said we needed to reissue the RFP, we had to increase the funding to get us through the rest of the state fiscal year so that the work could continue for the kids in out-of-home care.
So we are extending the contract 75%. But we are, in essence, doubling the cost, or at least doubling what we're asking for that 75%. Or at least we're increasing that by 100% for the next 75% of consulting fees. That's how my math works out. Does that make sense?
Yes.
Okay. Have there been an increased number of applications? Are we going to be doing more, an increased number of determinations in that period of time, or do we expect that flow to be pretty constant?
There have been more kids coming into care that we have been doing SSI eligibility determinations on.
Okay. All right. Thank you very much. That answers my question. Anyone else have any questions regarding this contract? Oh, Senator Meredith has a question.
What was the nature of the protest?
Astrid?
I am not sure on that, Senator Meredith, but be happy to get you that information.
In the original RFP, how many respondents did you get?
I believe there was 3.
And the company that was awarded the contract before the protest, how much difference was there in the pricing?
I don't know the answer to that.
I don't know the answer, but I'm happy to get you that information as well, Senator Meredith.
Well, to that end, I assume with 3 contracts, these were scored, correct?
Yes.
And the company that was originally awarded the contract was at the lowest price or the best score or both?
It would have been the best score, which would have been a combination of the pricing and the technical response.
But you don't know the nature of the protest.
I do not, I'm sorry, Senator Meredith, I do not off the top of my head, but I will happily get that information for you.
I would appreciate that. And Mr. Chair, I'd like to request deferral of this contract because I would like to know what the pricing was from each of these 3 groups and what the scoring for each of the contract was so that we can see where the difference is.
We have a motion for deferral. Do I have a second? We have a second from Co-Chair Hart. All in favor, please vote aye. All those opposed, clerk, please call the roll.
Senator Meredith.
Aye.
Senator Richardson. Aye. Senator Thomas.
Mr. Chair, I'd like to explain my past vote, please.
Explain your vote, please.
Okay, yes, I'd like to explain my past vote. I'm not at this point prepared to say that I wouldn't approve this contract. However, I must acknowledge that Senator Meredith, raises a good question in that it would be important and prudent for us to know at least the nature of the protest. I mean, I think we need to know why there was a protest and what was the nature of that protest. So I'm not prepared to say no either. So at this point I'm just passing, and however this vote ends up, I will accept.
Representative Bowman. Representative McCool. Representative Rourks.
Pass.
Representative Hart.
Yes.
Chairman Douglas.
Aye. Thank you. The motion passes. The contract will be deferred to the next meeting.
Mr. Chair, before they're excused, if I may, I want to make sure they know exactly what I'm looking for. And first, again, I want to know the nature of the protest. And I guess hand in hand with that is who filed the protest, what the contract price for each of these proposals was, and lastly, the scoring for each of the contracts.
Is that clear?
Yes.
Okay. Thank you very much, ladies. Thank you very much for your time. Next item on the pulled list is with the Department of Highways, and it's number 10 on the Personal Services Contract Amendment Ivory list. It seems the presenters are virtual, so please identify yourselves.
That's correct, Co-Chair Douglas. I'm Eric Pelfrey, our Director of Professional Services with the Transportation Cabinet.
Thank
I'm
you, Mr.
joined
Pelfrey.
by our project manager for the contract, Andre. Do you want to introduce yourself as well?
Yes, thank you. Hello, everybody. My name is Andre Johannes. I work with Department of Transportation.
Thank you very much. Gentlemen, would you please raise your right hand? Do you solemnly swear to tell the whole truth, and nothing but the truth?
I
Yes,
do.
sir.
Thank you. Now, I have a couple of questions here. This is a preliminary study, a preliminary engineering study. But I'm looking at some of the dates, and I see this 7 years in the making. Could you help me out with that a little bit?
Andre, do
I
you
see
have
this
any details?
I see this in front of me now, and has this been brought up every year? I'm just trying to find out why we are going back to April 10, 2020.
Correct. The contract started back in 2020, I believe. We've had, I think this is the 5th contract modification, either the 5th or the 4th. This one is just to extend for time. So no additional funds were included with this contract modification. Andre, do you have any details about the overall scope and phase 1 versus phase 2?
No, the phase 1 took us a little bit longer than what it usually does, and we went to phase 2 last year, if I'm not mistaken, and there was a big development that going on northwest quadrant with the Baptist Health coming in there, and that kind of made us to do a little more traffic studies because of the new traffic that we are expecting to be there, and that has made us to make the bridge, the Kentucky 329 interchange, a lot. Initially, we had probably about 7 lanes over there. Now we're going to end up with 8 lanes.
So what? I don't mean to interrupt you, but we need to keep moving. So what are the people who are watching? What they need to understand, or let me make sure that I'm hearing what you're saying. There has been an increase in the contract because there have been changes over time. There's been an increase in the amount of money being requested. Even though this says there's no increase or decrease, you're telling me that there's been contract modification. So when someone tells me there's been no increase or decrease, it lets me know that the contract is proceeding as it was, and we're not asking for any extra money. That's not how I'm reading this when I read this.
That's not entirely accurate, Co-Chair. I'm pulled up the full details. So we did issue the first contract back in April of 2020.
Mm-hmm.
And as typical with our process, I know we've been through this several times, but we advertise typically for phase 1. So I apologize. It looks like the details on this one are incorrect, because as Andre stated, this one is actually just a complete final roadway design.
Okay.
So we did, the first contract was for $718,000. And again, I know we've talked about this in the past. It's more prudent for us to advertise for phase 1, then we mod for phase 2. That's all set up gratefully to you and your friends at the General Assembly. We do that by phases because it's more cost effective and more efficient for schedule to do so, rather than taking a look at the entire swath.
Okay, I just want to make sure that our public understands how their money is being spent. I'm just trying to get that information out there.
Correct.
Second question.
Yeah,
it's some federal money and some road funds. Could you tell me what percentage is on each side? What percentage of the money is
80-20, I think.
80-20?
Right. It's a traditional 80-20 split,
Okay.
80% federal.
All right. Thank you very much, gentlemen. Any other questions regarding this contract? Yes. I have Representative Petrie.
Thank you, Mr. Chair. help me understand what this project is. How could I identify that elsewhere in state government? Is it, you mentioned an interchange. What is this project?
I'm sorry. It's a 4 miles of interstate widening of I-71 from mile marker 14 to 18, and it includes this one interchange that it's at the beginning of the project.
In what county or near what city?
It's I'm sorry. It's Oldham County.
Near?
It's
Is it the Kentucky 329 interchange? Andre?
Yes.
All right. Thank you.
Crestwood, I think. It's Crestwood.
Thank you, Representative Petrie. Okay. Do we have a motion to consider the contracts reviewed without objection?
So moved.
We have a motion by Representative Hart. Do I have a second? Okay. We have a second by Senator Thomas. All those in favor, please say aye. All those opposed, say no. Clerk, would you please call the roll?
Senator Meredith. Aye. Senator Richardson. Aye. Senator Thomas. Aye. Representative Ballman. Aye. Representative McCool. Representative Rourks.
Aye.
Representative Hart.
Yes.
Chairman Douglas.
Aye. Contract is approved. Thank you very much, gentlemen.
Thank you.
Thank you.
The next items on the pulled list are with facilities and support services, and they are number 28 and number 23 on the personal services contract amendment Ivory list. Number 28 and 32. Okay. I think the people presenting today are going to be virtual.
Yes.
Yeah, that's right.
Oh, okay. Would you please identify yourselves for the committee members?
Good afternoon. It's Barbara Dickens, General Counsel of the Finance Cabinet.
Scott Baker, Executive Director of Office of Facility Development and Efficiency, Finance Cabinet.
Thank you both. Would it be okay with the committee if we take these two together, or? All right. Well, we will do that. And since I have some questions, I don't mind doing that at all. Would you both raise your right hands? Do you solemnly swear to tell the truth, the whole truth, and nothing but the truth?
We do.
I didn't hear you, miss.
I
didn't hear
do.
you, Barbara. Okay. Thank you very much. Okay. My questions. I'll start out with number 28. There was a significant increase in what is being asked for. Help me out a little bit with a contract that we're looking at that's $22 million for architectural funds for architect selection. Would you help us understand why it costs so much money?
Yeah. So this is the architect firm and the team, if you will, for the capital renovation project. So this contract is not just the architect, but it's also the structural engineers, the MEP, mechanical, electrical, all of the disciplines of the design, the historic specialist, all of the design firm team are part of this contract under this one contract with EOP. So when EOP did the original presentation and went through the selection process a number of years ago, they presented as a team with all of the disciplines and all of the various required consultants that are needed for this very important project. So that's what makes up this contract as a whole.
Okay.
Does that answer your question?
It does answer my question. When I look under contract description, it simply says provide funds for architect selection for the state capital exterior renovation. And I just think that we need more information in this committee when these things are presented. Have you come up with a time when you think we will be able to complete this project, or an estimation?
We're currently working through final budget reconciliations and getting ready to bid the project, final phases of the project soon.
Based on those estimates and most recent delivery times on equipment, we're probably somewhere in the 2028, late 2029 area. We're still having large lead times on electrical switchgear. Some electrical switchgear is showing as much as 2 years in delivery currently because of the size of the switchgear in this building. So those are variables that we don't control at this point. But as soon as we have them under contract, that will help iron those down. So I would say at this point we're projecting 2029, and I'm fairly comfortable that we'll be within that.
If we move on to contract number 32, there's a significant increase, almost 100% increase, in actually it's over 50% increase in what is being asked here. Could you explain that to me as well?
Yes, sir. So this is for the Department of Juvenile Justice, where we did the initial studies of all of the campuses around the Commonwealth, and we did the initial evaluation for all of the campuses. And then this is the rollout of the retrofit for the Fayette County Juvenile Justice Center, Phase B through D design as a portion of this. The retrofit from the McCracken County Juvenile Justice Decision, Phase B through D design and construction administration is a portion of this. And Breathitt County Juvenile Detention Center is also Phase B through Phase D design is the third part of this particular contract amendment. So it's actually the full design through completion of the construction phase for Fayette, McCracken, and Breathitt is what makes up this change.
Thank you for the clarification. We can vote on these separately if the committee wishes. Okay. We have a question by Representative Petrie first.
Thank you, Mr. Chair. So I'm still looking at item 32, beginning back in 23 to current, architectural increase, and we're dealing with Fayette, McCracken, Breathitt. I think I caught all of those. I just want to make sure this is not construction funding. This is additional funding for design. Is that what this is?
Yes, this is the design for the retrofits of those 3 facilities.
And when do we think the design will be finished?
So the design is expected to be completed for Fayette in, give me just one moment. I don't want to give you late spring of this year. I went through this morning. Hold on just one second, please. So June and July of this year is when final bid documents are anticipated. The construction schedules for each one of these 3 are estimated to be quite different because of the scopes of work. So anywhere from 12-month to 20-month construction phases are what occur at each one of these campuses.
And if I'm understanding you correctly, then the construction is anticipated to start on each of these sometime in the late second half of 25?
Yes, sir. That would be correct. Yes, sir.
All right, thank you.
Thank you, Representative Petrie. We have a question from Senator Thomas.
Yeah, and I just want to go back to some of the comments that Representative Petrie made, because as all of us know, we've been at this very intensely for 2 years now. It was in January of 2023 that this first came to the attention of the legislative body about the problems that had surfaced down in Adair County regarding our juvenile detention system and our whole juvenile justice program. And we had a task force that looked at this very intensely throughout 2023 to try to get it right, and we still had some issues outstanding in 2024. So this has been a subject of a lot of iterations. All of us know a lot of iterations over the last year. We're finally getting to the point now where we're building out these facilities so that it can meet safety standards, so we don't have the problems that we've experienced in the past. And so with these iterations and with these delays and reviews, that does indeed cost money to make sure we get it right. So I can understand, in my mind, why there might be some increases, because this is something that we've looked at very intensely over the last couple of years.
Another question by Representative Petrie.
More of a comment on this one. Yes, as to the comments just made, whenever one of these projects begins, we're given hard estimates and we're given timetables. When I see those change, especially on things that have had considerable work on them, then that's when I have questions. Thank you, Mr. Chair.
Thank you, Representative Petrie. Do we have a motion to consider the contracts reviewed? And I am more than happy to vote on 28 and 32 separately, but if it is the will of this committee, we will vote on them together. And I will ask, if it's the will of the committee, we will vote on these together. Do I have any objections to that? No? Okay. So do I have a motion to vote on both of these contracts together? Okay. We have a motion by Representative Ballman.
Second.
And a second by Chairman Hart. All those in favor will vote aye. All those opposed, no. Clerk, please call the roll.
Senator Meredith.
Aye.
Senator Richardson. Aye. Senator Thomas.
Aye.
Representative Ballman.
Aye.
Representative McCool. Representative Rourks.
Aye.
Representative Hart.
Yes.
Chairman Douglas.
Aye. Excellent. Motion carries. Thank you so very much, ladies and gentlemen.
Thank you.
Next item on the list is with the Office of the Controller, and it is number 4 on the Personal Services Contract Amendment Ivory list. Over number 45. Okay. And I understand these presenters will also be virtual. Is there anyone there?
Is this the Emeritus contract?
No, this is the Maxim Healthcare Services Holding Incorporated.
It's the same one. Yes, sir. I'm here remotely.
Okay, please identify yourselves for the record, please.
I'm Nathan Goins, Assistant General Counsel with the Justice and Public Safety Cabinet.
And I'm Lori Denhart, Assistant Director of Administrative Services.
Thank you both. Would you please
Juvenile Justice.
Would you both please raise your right hands? Do you solemnly swear to tell the truth, the whole truth, and nothing but the truth?
Yes, sir.
Okay. Thank you very much. Well, I have a question on this contract. First of all, the increase is close to a 45% increase. Could someone explain that to me in terms of funding?
Yes, Co-Chair. So as you're aware, DJJ switched to the 24/7 medical and mental health care model in FY25, and part of that program was rolling out the 24/7 care of the youth, and DJJ and underestimated those potential costs with that program when they rolled it out, and this modification was required to meet that increased cost. And it's actually a good problem, because since they've streamlined this contract to provide a one-stop shop for the staffing positions within the facilities, they've actually been able to fill more positions than anticipated, resulting in more cost in the contract. So that anticipated increase was due to that extra cost involved with the contract.
What levels of providers are we talking about here? Because we're talking about a contract where we're staffing for a longer period of time. So my question is, what providers are we going to be staffing with during those added hours? And during those added hours, are the number of providers at the facility going to be equal during the 24-hour period? Especially given that we're having a 45% increase.
The co-chair, so are you asking for the specific positions that this will entail for the facilities?
Well, in general,
whether or not,
are we looking at various levels of providers? Are we looking at a particular level of provider? I guess is my basic question.
So various levels. So for instance, there's a DJJ staff position, APRNs for the facility on the medical side, RNs, LPNs, and additionally qualified mental health professionals to provide the mental health care aspect of it. As far as whether or not the distribution of those positions or change, throughout the night versus during the day, I'd have to defer to Lori about that. She probably knows the answer better than I do as to that question.
Well, that's important for me to know, because if we're going to have a staff that's 100% during the day and we're going to decrease that staff to 25% at night, I'm not sure why we have a 45% increase in the cost of the contract. So
Senator,
that's a question.
Senator, I do not have that information on the staffing patterns with me, but I am more than happy to follow that up with you, sir.
Thank you very much. I do think the committee would be very, very interested in getting that information at whenever you could.
Yes, sir.
Okay.
Absolutely.
Thank you very much. Senator Meredith has a question.
May have a couple, Mr. Chair, if I may.
Proceed.
When was the decision made to go to 24/7 coverage?
I believe that happened at the beginning of FY25, and I believe it was associated with a legislative mandate.
Where did the funding for the 27 million come from?
So, Senator Meredith, as you're probably aware, DJJ used a variety of contracts from the past before FY25 rolled around to provide the medical care that this single provider does provide. So instead of using the various contracts that made up the different sources of those providers that staff those positions within the facilities, we streamlined to this one contract, and that resulted in cost savings. So again, we shifted funds from those various contracts that existed at that prior time and created this omnibus contract to provide 100% coverage for those positions within the facilities.
Well, I appreciate that, but I'm having a hard time finding the math, because this is from July 1, 2024 to June 30, 2026, which is consistent with biannual. If there was a savings, then how much was the actual increase? I mean, what did we budget originally for this?
It looks like, from what I am aware of, it looks like they budgeted around 13 million for FY25, I believe. And I can get that exact math for you to follow up if you would like.
Well, again, I'm struggling to try on the flow of the dollars. I appreciate you say that you consolidated these and there's a savings, but how much is the savings and how much is the additional staffing component of that? And I guess what I'm really getting at is I don't want Chairman Petrie in the next budget cycle to be surprised when we're asking for another few $1 million.
I understand your concerns, Senator Meredith, but as I stated before, the cost savings versus the amount of additional cost for staffing those positions that weren't able to be staffed before with the method and the models that were used did result in an increased cost. And additionally, the discrepancies in the projection budget of that. But again, I can get you the exact numbers if that would be beneficial.
It would, but that leads me to another question, and I've asked to address this issue before. Is temporary staffing is always the most costly staffing model. What attempts are we making to have less reliance on temporary staffing? Another issue with this is when you do that, they got to pay premium rates to all these people, all these different classifications of healthcare providers. It makes it virtually impossible for rural healthcare providers in particular to be competitive in this particular market. So what are we doing to try to reduce our dependency on temporary staffing for healthcare coverage?
Well, ideally, we would prefer to have employees employed through personnel to fill these positions, and that was, I believe, what was previously dependent on to fill these positions, resulting in not being able to fill them, as you're probably aware. And that's partially why we moved over. We have both employee positions within the facilities, as well as relying on the third-party provider to fill those positions, to fill the gaps, if so to say. But essentially, it's hard to compete, as you're aware, with these third-party providers that provide the increased compensation for the services that we just can't compete with.
Well, again, Lacey, you've got the access to state fundings, and most of our other healthcare providers in this arena don't. They're kind of capped. And I'm not trying to be argumentative, but this is a conversation that we've had, I think, the whole 8 years I've been on this particular committee. I appreciate the challenges of trying to fill these positions, but is our situation getting worse or is it getting better? You know, I'd like to see the last 8 years how this thing has evolved, and see the increases, and really see what efforts we're making to try to hire full-time staff rather than temporary staff.
I don't have that information in front of me, Senator Meredith, but I'd be happy to get it for you again and provide that information.
Well, again, I hate to speak for our Chairman Petrie here, but I think this is something we'd want to know, particularly going into the next budget cycle. So it's just always been a concern to me. And also, again, because other healthcare providers can't compete in this space. When we're being a major competitor like this, when we're spending $67 million for temporary coverage. So I don't think it's being fair to the rest of the state. That's all I have, Mr. Chair.
Thank you, Senator Meredith. Senator Thomas?
Yes, Mr. Chair, briefly, because we're spending a lot of time on this one line item. But I think all of us see how complicated this problem was, and how costly it is to try to fix it. Again, Representative Petrie knows probably better than any of us what we spent in the 24-26 budget on juvenile justice to address these problems. But we obviously spent a lot of money, and it's probably more money we're going to have to spend. So I just think this is this reality that we have to face, that we had a very serious problem for our Department of Juvenile Justice, and it's going to take significant time and significant money to fix it, to correct it.
Thank you, Senator Thomas. We have one more question from Senator Meredith.
Not a question, just to follow up on that comment. And I understand the challenges ahead of these folks. It's with everyone who provides healthcare services. But the point I'm trying to make is, at the state level, when we have these shortages, some way we can always find the funding. But if you're in the private sector and you're faced with this situation and you can't be competitive in that market, you're forced to close services. And that's what's most damaging to the healthcare in Kentucky, where we already have poor outcomes, again, particularly in rural areas. So, again, it creates an unfair competitive situation when it's state versus the public. So, just a comment, Mr. Chair.
Thank you. And I would like to say, if you're going to be sending the information, I want to make the two people I want to make sure get that information is Senator Meredith and Chairman Petrie. I want to make sure that Chairman Petrie also gets that information. Now, that being said, do we have a motion? Yeah, Chairman Petrie has a question.
Thank you, Mr. Chair. Just clarification. So I'm looking at the description, and we've got increased by 27 million. Is that just to provide potential coverage 24/7, or does that actually ensure an additional number of personnel that are available?
That should provide the coverage needed for those facilities for the duration of the period.
So it's more of an availability payment than it is actual putting more numbers of staff in play.
It will be an up to amount. Obviously, I don't think that we're filling the positions at 100%. That would be the goal. And I believe that amount would cover to fill the positions. Is that the question you're asking? I may not be answering your question.
I think I've gotten between the lines on that one sufficiently. You said there was a legislative mandate. Do you have the KRS for that, for this type of coverage?
I do not. Lori, do you have that information?
If you'll get that back to the chair for the committee's purposes. And then if I may, just one last piece, Mr. Chair.
Yes, sir. Proceed.
I'm looking at two different, this is for medical staffing, is that correct?
Yes, sir. Medical staffing and mental health staffing.
And mental health at the detention centers, right?
It would be at group homes, YDCs, and detention centers. I think around 22 different facilities.
Gotcha. I'm also looking at another description, the contract description. It says it's for critical health and welfare services. Is that something separate?
To my knowledge, I do not believe that welfare, except to the extent that it's through medical care or mental health care, would be involved.
Very good.
So it would respond to medical needs and mental health needs of youth in the facilities.
Very good. And then it says across all 120 counties, but we're only dealing with 20-something centers.
Correct, but it would serve the youth from all the counties because they are obviously taken to those different facilities within the state.
Yeah, not a problem. That gets me down to whether we're hiring additional people, making bodies available, or whether we have coverage at 22 facilities. I'll look forward to those details. Thank you, Mr. Chair.
Thank you. Any other questions? Senator Meredith has one more comment, please.
What's the current vacancy rate? Staff
For-
vacancy rate.
I don't have that information in front of me either, but I'll add that to the list if you would prefer to have it.
Do we track that?
I believe so, yes.
I would like to see currently in some historical, if you have that available, because I'd like to see obviously how this is fluctuating.
Yes, sir.
Thank you.
Thank you. Well, this is pretty robust discussion in this particular area. Do I have a motion to consider the contract reviewed without objection? We have a motion by Representative Rourke, and we have a second by Senator Thomas. All in favor of the vote, say aye. All opposed, say no. So, clerk, please call the roll.
Senator Meredith,
I'll explain my vote, Mr. Chair.
Yeah, make your vote and then explain, please.
Again, I understand the need for this contract, but I'm voting no because this staffing situation is something that every healthcare provider is feeling right now, but the need is more pronounced in rural Kentucky. And when we have contracts of this nature, it really places those providers at a distinct disadvantage. And I don't think the state should be in competition with the rest of our Commonwealth. So my vote's no.
Senator Richardson, Senator Thomas.
Mr. Chair, I'll briefly explain my I vote.
Go ahead.
As I've said repeatedly, this has been an ongoing problem for 2 years. We've had the U.S. Department of Justice come in to take a look at our facilities because there allegedly have been some civil rights violations that have taken place. Although nothing was ever filed by DOJ, they did come in and examine it. We've had a task force created by this legislature to take a look at this, and we've gone through a budget cycle to address this problem. So I mean, we've got to get it fixed. I think we've done an appropriate job of trying to address all the many issues that have occurred over the last couple of years, or 2+ years. I just think we just have to go forward and get this fixed. So I vote aye.
Representative Bowman. Aye. Representative McCool. Representative Rourks.
I'm going to vote aye, and I just wanted to briefly explain. I think we as a government have a responsibility to ensure that we are providing these critical healthcare services and mental health for these youth that are in various stages of detention and facilities, especially when we want to make sure that we're getting them on the right track and becoming productive members of society again. And a critical piece of that is making sure that their healthcare needs and complex behavioral services that are often necessary, are going addressed. And I have no doubt that that is some of the hardest work that someone can be doing, especially with our young people. So, I'm going to be voting aye.
Representative Hart.
Let me explain my vote, Mr. Chairman.
Go ahead.
I'm going to vote no, and the reason I'm voting no, I'm not totally opposed to the contract and the intent of the contract. My biggest issue is there's been a lot of questions raised, and I'm waiting on data to get some answers. And I just don't feel comfortable passing this contract without all the data. So
thank you, Mr.
I'm a no
Co-Chair.
vote.
Thank you, Mr. Co-Chair. I also vote no, and the reason I'm voting no is I'm not really sure that this contract is going to be putting boots on the ground. I think Representative Rourke was right. We are charged with providing for the critical services that they need, but I'm not sure that this contract is going to do that. I'm not sure that part's been satisfied. But with that being said, the votes are 4-3. So the contract will move forward. Thank you, gentlemen. Or, thank you.
Thank you.
The next item on the pulled list, next items are from the Department for Local Government, and they are number 12, number 18, and number 13 on the routine memorandum of agreement pink list. Oh, and 31. I don't know why I said 13. If the representatives are here, are we doing this virtual as well? This will also have some virtual representation, and Representative Petrie will have questions. But first, who is here?
This is Commissioner Matt Sawyers, the Department for Local Government.
Thank you very much. Would you please raise your right hand?
Oh, and we also, Mr. Chairman, we do have a staff person on that will probably testify as well. Aaron Jones, a branch manager for us. Would you like for him to testify at the same time?
Yes, sir.
Okay.
Would you
Aaron,
both raise your hands? I can't see that person, but
there he is.
I'm going to assume their hands are raised. Do you solemnly swear to tell the truth, the whole truth, and nothing but the truth?
I do.
Proceed, please. And again, Representative Petrie has some questions. Are you going to be presenting?
We're happy to answer any questions the representative has or anybody else from the committee.
Yeah. Do we have any questions? Someone pulled the contract.
I will.
Representative Petrie has
questions. So you go first.
All right.
I always like to have questions asked before they present.
Very good. Thank you, Mr. Chair. And the great news, Commissioner, is these are easy, clarifying questions, and I mean it. I think I just said
it is great news.
Chairman Petrie, I've heard that before.
So on item number 12 and 8, items 12 and 18 are very similar, but on item 12, this comes out of House Bill 1 in 2024, and it looks like it deals with the full amount for FY25 and FY26. I believe in House Bill 1, those were separate appropriations. Are you just trying to treat them together, or are you pulling the FY26 appropriation forward?
That's correct, Mr. Chairman. We do have appropriations for both fiscal years. I'll let Aaron talk to you about how those MOAs are set up. The specifics of that through the Finance Cabinet.
If I may, I'm really going to be pretty strict about the use of acronyms. I know we're really talking about memorandum of agreement. Is that what we're talking about?
Yes, sir.
Thank you.
My apologies. Go ahead, Aaron.
Okay, thank you. I think I understand your question, but in reference to the contract, we have the ability to actually include both appropriations for each fiscal year on one contract.
Right.
Does that clarify your question?
It does. I believe that is the clarification I'm seeking. So you're not trying to move the fiscal year 26 appropriation earlier. You just have a contract, a memorandum of agreement that speaks to each fiscal year with its own appropriation.
That is correct. And also, just because the fiscal year 26 appropriation is identified on the MOA, the recipient entity cannot access those funds until July 1st of this year or after July 1st.
Perfect. I told you it would be easy questions. And the same thing applies on item number 18, if I may. On item 18, Covington Life Sciences Partners, it's the same issue. I just want to make sure that the memorandum of agreement speaks to each fiscal year separately, and 26 is not being pulled forward.
Yes, that's correct.
Very good. And if I may, the last one is item 31, and it is a really easy one, I hope. House Bill 1, again, is the source. It's $2 million to Catawba Fire Department. Catawba's in Lyon County. Are the funds going to and were appropriated to the city of Catawba, or were they appropriated to the county? And which one is it that you're putting the funds to?
So under House Bill 1, the funds were originally appropriated to the city for the city fire department. With that being said, currently the city is non-compliant. They have not just one, but several audits that they are behind on. And according to KRS 91A 040, when that happens, any state funding will be withheld until these audits are completed and submitted, and puts the city in good standing. So with that being said, we wanted to make sure that this project still came to fruition, and there was conversations between the city and the Lyon County Fiscal Court. And basically what the city agreed to do was accept and pass the administration, and they did that through resolution, and I have a copy of that if you would like to see that. And the city agreed for Lyon County Fiscal Court to accept the administration of the project. And I would also like to add, I also talked to Judge Smith of Lyon County yesterday to confirm before this hearing that, to her knowledge, Representative Freeland and Senator Howe were both aware of this situation and were in agreement.
Understood. Mr. Chair, just quickly, I think I understand what's going on. I'm not sure that that's clean on the appropriation using a pass-through to bypass what is a purported statute that would stop funding. But I would also say, if you look carefully at that statute that was cited, it does not stop the funding. It simply says the Department of Local Governments to inform finance to stop. It doesn't give the power to stop. Thank you, Mr. Chair.
Thank you very much, Representative Petrie. Any other questions regarding this particular contract? Once again, we have three contracts, 12, 18, and 31. I am more than happy to vote on these separately, or I am happy to group these together. If there are no suggestions, then what we will do is we'll vote on all three of these together.
Motion to approve all three.
Okay. I have a motion by Senator Meredith. Second?
Senator.
Okay, I have a second by Senator Richardson over there. All those in favor vote aye. All those opposed, no. Clerk, please call the roll.
Senator Meredith,
Aye.
Senator Richardson, Senator Thomas, Representative Bauman, Representative McCool, Representative Rourke,
Aye.
Representative Hart,
Yes.
Chairman Douglas.
Aye. Motion carries. Thank you so very much for the information.
Thank you, Mr. Chairman.
The next item on the pulled list is with the Behavioral Health, Development, and Intellectual Disabilities. It is number 13 on the Memorandum of Agreement Amendment Yellow List. These people are virtual as well. I don't know if it was the snow or they don't have snow tires. I'm not sure what the issue is. Are the representatives present?
We are present.
Okay. Please identify yourselves for the record.
Hello, I am Caitlin Hood. I'm the Assistant Director in the Division of Substance Use Disorder within the Department for Behavioral Health, Developmental, and Intellectual Disabilities.
Do you have anyone with you?
I do, Director Johnson.
Is
Hello,
Director
my name is
Johnson
Sarah
going to be?
Johnson.
I'm sorry?
I was just introducing myself.
Proceed.
My name is Sarah Johnson. I'm the Director for the Division of Substance Use Disorder within the Department for Behavioral Health, Developmental, and Intellectual Disabilities.
Okay. Thank you very much. Would you please both raise your right hands? Do you solemnly swear to tell the truth, the whole truth, and nothing but the truth?
I do.
Okay. With that being said, I have a question regarding number 13 here. We are looking at providing funds to provide for opiate antagonists, and it says example Narcan. What other opiate antagonists are you looking at?
Our contract primarily distributes Narcan to individuals in the community, in part because it is the easiest to access from the distributor, and also because it is the cheapest product that's available.
Question number 2, we've got a significant increase in what you're asking for. Do we have documented evidence, written evidence, that that this increase will further reduce overdose deaths?
Yes, I believe in looking at the national literature, we know that widespread access to this life-saving medication, Narcan or naloxone, can drastically decrease overdose deaths in the community.
No, my question was, do we have documented evidence that it does? I'm not asking about can, because there are a number of people who believe that the increase in the Narcan simply pushes the overdose deaths down the road. So I'm just asking about the evidence that we are being asked to review as a committee when we're looking at such an increase in what we're being asked to approve for the Narcan. I just what data is there?
It is one of many effective tools at reducing overdose deaths. Of course, we also want to focus on increasing access to effective treatment and recovery services, but it is one of the myriad of tools that is essential in reducing overdose deaths.
So, in hearing what you're saying now, am I to understand that it is not just simply for the Narcan, it's going to be used for other substance use disorder activities? Is that, I just want to make sure that the committee is aware of that, because that is not what it says.
I'm sorry, could you restate the question?
Okay. The description is provide funds to operate an opioid antagonist, opioid antagonist distribution program in partnership with the Kentucky Department of Public Health. And my question is this money primarily going simply to purchase and distribute the Narcan? But then I sort of misunderstood maybe something that you said that said something about other programs. I'm trying to find out whether this is going toward Narcan or if it's going to other activities.
Yes, thank you for restating the question. So this is one of our contracts through the Kentucky Overdose Response Effort, or CORE, that is housed within the Department for Behavioral Health, Developmental, and Intellectual Disabilities. And so what we do through CORE is we support our state, Kentucky's distribution of state opioid response dollars from SAMHSA. So this is a federal grant. Of course, what we do through CORE, or part of our program, is to distribute naloxone to the community. But as I said, that is one of several approaches that we take. We also support prevention initiatives, we support treatment initiatives, and we support recovery initiatives. So this is one of our many programs that we support through the state opioid response grant dollars from SAMHSA.
I'm not sure that clarifies the question that I've asked. I would ask, Senator Meredith also has a question. Senator Meredith?
I do, Mr. Chair. Thank you. Is this 100% federally funded?
It is correct.
And this is obviously some forward thinking here, but has any thought been given to what happens if those federal funds are no longer available?
It's a fair question. At this point, we are unsure if the federal funds go away. We will ultimately have to cross that bridge when we come to it. As far as we have heard from our contacts at SAMHSA, well, we have not heard. We have not had communication with them as of when the new administration took over. So we don't know. It's a fair question.
Well, I appreciate the answer, but I've always believed that you worry about cross Fox River when you get to Fox River, but we know that probably in the future we're not going to see the level of federal funding that we have in the past. And I would just encourage you, as well as every other state agency, if you're relying on federal funding, which obviously we are, about $15,000 per capita in Kentucky, you need to be developing some contingency plans to address this, regardless of whether the federal government cuts that funding or not. We just need to be prepared. So I just don't like surprises. But that's all I have, Mr. Chair.
Thank you very much. Any other questions? Thank you, ladies. I just want you all to know that we are not here to criticize, and we're not poking fun in any way. We're simply trying to ascertain whether or not the contracts that we are approving are actually doing what those contracts are intended to do. That's all we're doing. So thank you very much. Do we have a motion to consider the contract reviewed without objection? Was that didn't work? Okay. We have a motion by Representative Rourke and a second by Senator Thomas. All those in favor vote aye. All those opposed vote no. Clerk, please call the roll.
Senator Meredith,
No.
Senator Richardson, Senator Thomas,
Mr. Chair, with whom am I speaking? What's the young lady's name?
Would you please repeat your name, please?
My name is Caitlin Hood.
Ms. Hood.
Ms. Hood, I'm going to vote yes, but I do want to say two things. One, I really don't think you answered Senator Douglas's question. I think he raised a good question about, have you demonstrated that your use of Narcan is going to work and you're going to cut deaths? And you referred to literature and reports, but you didn't give a hard answer as to your evidence or your research has indicated that this happens. So that was somewhat unpersuasive in my mind. Secondly, I think Senator Meredith's point is spot on. Anyone who's listened to the news in the last month understand that any kind of federal funding is at risk at this moment. I would say that if we weren't using federal fundings here, my vote would be different. But because we are using federal funds here for the present time, I'm going to vote yes. I second it for my colleague, in support of my colleague, Representative Rourke. I'm going to honor that. But I do think tomorrow you ought to be seriously considering a plan B, just in case. I vote aye.
May I offer just 2 points of clarification? Is this an appropriate time to do so?
That's your call, Mr. Chair. If she wants to ask me a question, I'm not going to dodge her question.
Perhaps we could do that after the vote. We're in the middle of the vote, but perhaps after the vote. Would you continue?
Representative Bowman. No. Representative McCool. Representative Rourke.
Aye.
Representative Hart.
Yes.
Chairman Douglas.
I'm going to say aye, but I really want to. I'm going to explain my vote. I actually agree with Senator Thomas. Now I want everybody to be okay. It's all right for me to do that. I think Senator Thomas made a really good point. I have not seen the data that has suggested that overall we've reduced those incidents, but the overall incident of overdose continues to rise, which is why we're asking for more Narcan. And I don't think there's any doubt about that. But given that, the motion carries. And you're more than welcome. Yeah, the motion carries, but you're more than welcome to state some very quick, in under 2 minutes, clarifications.
Sure. Thank you for that opportunity. And my apologies for not addressing the question adequately before. So what we know is from the past 2 years in Kentucky, we've seen a decrease in overdose deaths. In 2 years ago, it was 5%, and last year it was a 9% decrease, 9.8% decrease in overdose deaths across the state. What we have seen through our distribution of naloxone statewide in the past 2 years is that this distribution increased 110% in the past 2 years. And while there are, of course, a myriad of factors that contribute to the reduction in overdose deaths that we've seen, I would be remiss not to believe that naloxone plays a central role in keeping people alive. And that's all I will add. Thank you for your time.
No problem. I agree. It does keep people alive for that period of time. But I think more data. I think the data is still out regarding whether or not it simply pushes those deaths down the road and lowers the height of the bell curve. But thank you very much. I appreciate you all being here. Thank you very much. And the last item on the pulled list is with the Department for Medicaid Services. It is number 24 on the Memorandum of Agreement Amendment Yellow List. The representatives or the presenters are virtual. Are you here?
Yes, I'm here. I'm
Okay.
Lisa Lee. I'm the Commissioner for the Department for Medicaid Services. And in attendance with me is Edith Sloan, the Division Director for the Division of Health Plan Oversight.
Welcome to both of you. And Miss Lee, we miss you not being here with us today.
I miss you too.
Would you both raise your right hands? Do you solemnly swear to tell the truth, the whole truth, and nothing but the truth?
I do.
Thank you for both of you. All. Co-Chair Hart has some really good questions. Co-Chair.
Thank you, Mr. Chair. Could you, just for the committee, we've got several new people on the committee as well. Could you explain what connector is and what their role is?
Sure.
What the program is?
Yeah, a connector is an individual who is out in the community and who assists individuals in completing applications for Medicaid and also assists them in finding or connecting them with doctors. So Medicaid eligibility is probably one of the most complex processes in Medicaid. And particularly that's the case for long-term care eligibility. So our connectors not only help individuals fill out applications, they make sure those applications are complete and any supporting documentation that we need to verify that they actually qualify for Medicaid is obtained and delivered. We also do several, we do outreach, or our connectors, I say we're our outreach connectors. For example, we have an organization in Lexington that will be closing, and so we know individuals will be uninsured. We go to those locations, we assist those individuals in applying for health insurance if they will need health insurance to maintain their health while they are looking for other employment. So we do have some of those plans reached, and they do so much more than just eligibility. And Edith, would you like to fill in some things that I have left out that our connectors
Sure.
do?
More than anything, I think they offer resources, other resources, not only state resources. Connectors are from that area, so they're aware of the churches and the food banks and everything. So they absolutely become part of the community and help the people in that community connect with resources other than just state resources also. But they also help with a SNAP application for qualified healthcare plans and for childcare also. So they are there. I would like to add too that in emergencies, when we had the flood in Hazard and we had the tornado in Western Kentucky, they packed their bags and they're there. They were there within 48 hours helping the community, engaging with them and getting them coverage and helping them with pharmaceutical supplies and things like that.
Well, thank you for that. So, based on your answer, it's pretty clear that they do more than just enroll people into Medicaid. There's
Yes.
a myriad of programs that they help them with when the need arises, correct?
Correct.
Okay. Why are the Medicaid funds being used for non-Medicaid administrative activities? Can you touch on that a little bit?
I'm not sure that I understand.
Well, and some of this might be my ignorance within the program, but the main reason, and correct me if I'm wrong on this because I am trying to learn about this, the connector wasn't their primary role or the primary goal of when that program was established was to enroll people into Medicaid?
Yeah,
Or is
that is correct. And their role has expanded. And this contract, I should have stated, is not strictly Medicaid funds. This contract is split between other offices within the Cabinet for Health and Family Services, such as the Department for Community-Based Services. So those activities that are not Medicaid related, we would not be using Medicaid funds for those activities. They would be coming from other agencies.
Okay, so I think you just answered or hit on the point I was trying to. The connectors activities with Medicaid, it's funded out of the Medicaid fund, for lack of a better term, but the other activities, they are funded out of the respective funds for them types of activities, correct?
That is correct. Based on federal rules and regulations, we do have an obligation to do outreach and education for the Medicaid population and the Children's Health Insurance Program population. So we at Medicaid had this contract. We saw opportunities for those connectors to assist in other areas. For example, the state nutrition, I forget what SNAP stands for, but it's the Supplemental Nutrition Assistance Program, and child caring services, and those are housed within the Department for Community-Based Services. So we leverage this contract to help those other agencies, and the funding for it is cost allocated across all programs.
Is most all this federal funding?
About 65% of this is federal funds.
So I mean, knowing that some of the federal funding might likely be coming to an end in the near future, I guess if you lose federal funding for certain activities, the connectors would just stop performing them activities and just strictly perform the activities that the state's funding. Is that correct?
In the event that federal funding is reduced, we will evaluate, make sure that we are prioritizing the funding for programs to ensure that we continue to operate the Medicaid program as efficiently and effectively as possible going forward, and in compliance with all federal rules.
All right. Well, thank you, Mr. Chairman. That's all I have.
Representative Petrie.
Thank you, Mr. Chair. I noticed that this has federal funds and general funds combined in the increase, and I think you said that it was across multiple department agencies. Is this triggering or causing a trigger of a request for an allotment modification through the Office of State Budget Director, or has this been handled otherwise?
No, we are not asking for an allotment. We believe this is well within our current appropriations.
Very good. Thank you. Thank you, Mr. Chair.
Thank you very much. Any other questions? Okay. With that being said, do I hear a motion to consider this contract reviewed without objection?
So moved.
So moved. Motion by Co-Chair Hart. Do I hear a second? We have a second by Senator Richardson. All in favor, please vote aye. All opposed, no. Clerk, please call the roll.
Senator Meredith,
Explain my vote, Mr. Chair.
Yes.
I'm voting no because I keep seeing increases in expenses that for various programs across the Cabinet for Health and Family Services, and it disturbs me greatly that we passed a bill last session to fund kinship care. And it was been told time and time again that, first that the money was there, and then we're told, no, it's not there. But again, I keep seeing these increases that I don't know that have a higher priority than kinship care payments should have, so I'm a no.
Senator Richardson, no. Senator Thomas, Representative Bauman,
No.
Representative McCool, Representative Rourks,
Aye.
Representative Hart,
Yes.
Chairman Douglas.
No. This contract will continue to move forward. Commissioner Lee and Ms. Sloan, I want to thank you both for taking the time. Again, we wish both of you were here with us having a wonderful time. But thank you for the information.
Thank you all.
Thank you.
I'm going to ask members of the committee, please take a moment to review item number 11 on your agenda, which has to do with military affairs and the Division of Emergency Management and their request for exemption. Okay, we have a motion by Senator Meredith to approve, and we have a second by Co-Chair Hart. All those in, did we do a roll call vote? Or did we do okay, all right. All those who are in favor say aye. All those who oppose, no. Please call the roll.
Senator Meredith.
Aye.
Senator Richardson.
Okay.
Senator Thomas. Aye. Representative Bauman. Aye. Representative McCool. Representative Rourke.
Aye.
Representative Hart.
Yes.
Chairman Douglas.
Aye. Motion passes. Now, before adjournment, I want to announce that the next meeting will be March on March 11. Some of the writing, and it will be chaired by co-chair Hart. And it will occur upon adjournment of both chambers. Do I have a motion to adjourn? Motion to adjourn.